So today, actually, I'm going to talk about the Autism Center under King Fahad Armed Forces Hospital. Um, the center is under Prince Mohammed bin Salman program for autism and other developmental disabilities. So the center, I'm going to stop the... Okay, so the center is one of 7 centers under the program. It's actually, it started, or it opened at the very end of 2016, in December of 2016. And we started providing services at the beginning of 2017. So we have been around for a number of years, a few years for now. The center started to provide services for children with autism because of the limited number of available services for autism, and the aim was to provide evidence-based practice, or in general services that in alignment with best practices. So the center started with a small number of staff. Actually, we started with 5 people, like a consultant, child and adolescent psychiatrist, myself, one clinical psychologist, one social worker, and then the team started from there, and then we started having more staff. So the center has been providing a range of clinical services for children with autism, and also targeting training families and working in alliance with the families to provide clinical services. To improve kids' skills, to empower families. Also, the center focused on spreading awareness, and also to set a stage for like providing a training place for providing best practice services. This is the center in pictures. So we have a number of services provided in the center. We have the outpatient clinics, we have the early intervention program, the community outreach, research and training and awareness. These are the areas that we focused on. And the outpatient services has different or a range of clinical services, evaluation and diagnosis, child and adolescent psychiatry, social work, speech and language, behavior modification, and psychological services. And from there, actually, we are providing more and more services branching from those core services. For example, like for counseling, we're providing now individual counseling, family counseling, sibling support. So a range of counseling services. Also for behavior modification sessions, individual. Now we're starting for groups as well, for social skills, also for speech. So we are branching out with a range of services according to each area. These are our clinics. This is how a typical clinic would be looking like. Okay, and then the early intervention services, the focus is to target the children younger than 5 and younger. So teaching skills, providing individual, group, and family training, and then increase independence. Intervention, of course, is based on ABA services. I'm going to talk later about also our team. Okay, these are the intervention clinics or units. This is how it looks like. Again, you can see there is a room for group work, and then like a small table on the side for individual work. And the third area we focus on is improving tests, advertising and validating our tests to the Saudi culture, improving screening, and looking at also screening for comorbidities of other disorders with autism, screening for siblings and newborns, plus research and treatment protocols in general. Okay. Overview of the center, as I mentioned, it started in 2017, serving children or individuals 0 to 16 years old. However, we are providing some adult services based on the need. Sometimes we are referred some adult services for because we are a specialized center for evaluations and also for intervention sometimes. So we have a limited number of adults who are we providing services for. So far, we have 991 individuals since the beginning of the services in our center. So providing services for this number and their families. Children younger than 6 so far until now. Of course, this number changes from year to year, but now it's 269. Staff in the center, we are about like 31. One consultant child and adolescent psychiatrist, clinical psychologist, one pediatrician, 3 master level clinical psychologists, 3 BCBA, 1 social worker. We have 11, mashallah, special educators with ABA background, who 10 of them are graduates of Dar Al-Hekma. One is getting the courses for ABA and trying to get also certified. 2 nurses, a patient coordinator, 1 SLP bachelor level 2, 1 is actually abroad to get her master. We have 1 secretary, 1 receptionist, housekeeping, 2 security, 1. The number, like the gender, we have 80% of our kids males and then 20 females. And it's almost typical because for every child, for every female, we have 4 males diagnosed with autism. We have services that are, as I said, in alignment with best standards. So we are very proud of the evaluation and diagnosis services that we provide. It's based on best practices in terms of the tools, the procedures we follow, the team that we have in the evaluation team. And then the process is that after the children are referred to us, we do the initial stage of getting information, and then actually here the first step, and then we refer them to the diagnostic, to the intervention services. We schedule the evaluation. And then the child comes with the family. We implement different tools, ADOS, ADI. We have different screening measures, such as the SRS, ASRS. Also, we screen for other disorders, or like to look for other abilities. We conduct IQ measures. It depends on the age and the functioning level. Sometimes we use adaptive measures. We use also behavioral observations during the evaluation. All of those, plus the clinical experience of our staff and their specialty in autism, and to make the decisions about the autism spectrum. And then the last stage is basically we give feedback to the family after we discuss among the team, and then we follow up with the family for intervention. In the last stage also, with feedback, we refer them for our social worker to coordinate and help them and support them in terms of reaching out for community resources and community fundings and connect them with the school system or our center. So we follow up even with services outside our center to coordinate. These are pictures of our assessment for the ADOS. Okay. and the ADI, as I said, and these are some of the measures we use. For early intervention, our team use like different measures actually to assess the child's functioning, such as the ABLES. They get information for the adaptive measures we give to the family, and it's in the child's file. We get family input by interviewing the family, the first meeting with the behavioral therapist to look at the family's needs, family's difficulties, their input about the child's functioning. So we do a family interview looking at their to see where we put the intervention strategies. And of course, behavioral observation, but then in collaboration with the family, we put the intervention plan. These are the pictures for the ABLES assessment. But as I said, we use a combination of different measures to put the intervention plan. So we do the assessment and the intervention, the plan, and then intervention is based on ABA strategies. We target skills in all domains, and our staff, they take daily data on child's performance. The 5th day of the week, usually when the family comes in to get training on the strategies that were implemented throughout the week. So to make sure that we promote and generalizations, and also to make sure that the family is empowered and they know exactly what to do, and also to ensure the continuity of care at home and in the community as well. As I said before, we provide individual and group sessions. The goal is to increase independence of the child. And of course, also we have continuous assessment of skills to monitor progress and update the intervention plan. Okay. The outpatient services, actually, as I said, it's expanding as we see like the needs of the families and the children. So for the outpatient, for speech, our staff have been trained on providing Hanan, and we have a great experience, a very positive experience with using this program with families. We have had challenges. I'm going to talk about them in a bit. Why we expanded also in different services to cover a range of needs. Also, we have like services covering for siblings, screening for and following newborns, providing social skill groups, workshops for families, intensive behavior modification training for families. All of those services are provided at the center. Overcoming challenges. It's a continuous, again, process because with the increased needs of our siblings, with the increased number of children coming to our center, we have more demands to meet. For example, at some point we had difficulties, and we keep having these difficulties with families needing speech and language services, and with the limited number of staff we have, we thought of providing orientation in which we have more groups or a big number of families attending workshops or training, and we have it like at least once a week, no, once a month, I'm sorry, and then and we introduce them to difficulties, raise awareness about milestones, what to expect, and strategies to stimulate language at home. And then we are providing like some training in groups like Dhanan, and then later we divide them to have individual families, and then intensive also for each family to make sure that they get some strategies based on their child's needs. Also, with the increased need for early intervention services, we try to provide, in addition to the early intervention program, like intensive, short-time intensive program for kids younger than 5 over like a 3-month period. So this way, even children who are not enrolled on our intensive early intervention program, they get an intensive program to work with their kids. Getting qualified staff and continuous training is also something that we have been very careful from the beginning about how to wait and get the best staff that we need. During COVID, of course, so many places have had so many challenges. So we switched our services, diagnostic services. We have created procedures to fit the virtual services. So we wanted not to stop, and we continued providing all kinds of services through virtual. Also, the early intervention program, the same intensive time-limited intervention program continued through COVID times and the lockdown. Early identification, this was challenging also at the beginning for us, and then we have worked with different departments within the hospital, like the pediatric department and the family medicine department, to make sure that during the well baby clinics and to in general, even during their visits with the babies and the toddlers, what to look for in terms of early signs of autism, and to do referrals in a timely manner. We did a lot of collaboration within the hospital with other departments. We have had families telling us that their kids are having difficulties with, like, going to the dentist or having blood withdrawn. So we have done a lot of training. We have had people coming to our center, like such different dentists coming for a month to do some training, to look at to pair them with behavioral specialists to ease the transition, to work on using reinforcers. So we have had really great experiences. Also, we worked with the lab, how to have different strategies to help the child have an easy time during this procedure. Okay. And I think I didn't take a lot of time. I hope so. Maybe just 20 minutes. This is the end of the presentation. And Dr. Sarah, let me know, do you want us to take questions at the end? Do you want me to stick around? What to do?
So we're going to take questions at the end. Okay.
Sure.
Yeah.
Okay.
Yeah. Thank you very much, Dr. Amal, for that.
You're very welcome.